Ever pondered about what atherosclerosis is and how it affects your heart? Let's delve into this common cardiovascular disease that silently and progressively affects millions. Atherosclerosis, in simple terms, is the hardening of your arteries. Imagine a pipe carrying water. Now imagine if that pipe starts to narrow down due to a buildup of substances. That's what happens in your arteries with atherosclerosis. But what's building up inside your arteries? It's called a plaque, a sticky substance made up of fat, cholesterol, calcium, and cellular waste. But how does this plaque form? It all begins with an injury to the inner lining of the arteries. Now, this injury isn't like a cut or a bruise you get on your skin. It's microscopic and often caused by factors like high cholesterol levels, smoking, hypertension, or diabetes. This injury triggers an inflammatory response in your body, which is like your body's alarm system ringing, calling for help to repair the damage. However, this repair process isn't as straightforward as fixing a broken toy. Your body sends out cells to the injured site, and these cells start to accumulate the aforementioned substances, creating a plaque. Over time, this plaque expands within your artery. As it grows, it can get inflamed and its outer shell can rupture, pouring its contents into your bloodstream. When this happens, it can trigger the formation of clots that block the blood flow. This is similar to a traffic jam in your arteries, but with far more dangerous consequences. It can lead to severe conditions like heart attacks or strokes, depending on which artery gets blocked. So, atherosclerosis isn't a disease that happens overnight. It's a slow process that takes decades to develop, often without any symptoms until it's too late. And that's what makes it so dangerous. It's like a ticking time bomb in your arteries, quietly growing, waiting to explode. Atherosclerosis is a slow but dangerous disease that can lead to severe heart conditions if not managed timely. As we move forward, we will explore the main causes and risk factors and discuss how to prevent and treat this stealthy disease. A multitude of factors contribute to atherosclerosis, some of which are within our control. Smoking, for instance, damages the inner lining of arteries, setting the stage for atherosclerotic changes. Obesity, another major player, often goes hand in hand with high cholesterol and blood pressure levels, both of which can expedite arterial damage. Now, let's talk about diet. An unhealthy diet, particularly one high in saturated fats, can lead to increased cholesterol levels, further contributing to plaque formation. On the flip side, a lack of regular exercise can lower your body's ability to manage blood sugar and cholesterol effectively. But it's not just lifestyle. Underlying medical conditions like diabetes can accelerate the progression of atherosclerosis by causing chronic inflammation and damage to arterial walls. Furthermore, inherited genetic changes can increase your susceptibility, showing us that family history plays a significant role too. Being aware of these risk factors can help in early detection and prevention of atherosclerosis. While atherosclerosis can be daunting, there are ways to manage and even prevent it. One of the most effective ways to keep the disease at bay is through lifestyle and dietary changes. A diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce the risk of atherosclerosis. It's important to limit intake of saturated fats, trans fats, and cholesterol, which contribute to plaque buildup in the arteries. Regular physical activity, at least 30 minutes most days of the week, can also aid in maintaining healthy arteries. In addition to these lifestyle changes, managing other health conditions is crucial. This includes maintaining optimal blood pressure, cholesterol, and blood sugar levels. If you're a smoker, quitting is one of the best things you can do for your heart health. Now let's turn to conventional treatment guidelines. If lifestyle changes aren't enough, medication may be necessary. Statins are often prescribed to lower cholesterol levels. Antiplatelets are used to prevent blood clots, reducing the risk of heart attacks and strokes. Beta blockers can lower blood pressure and reduce the heart's workload. In more severe cases of atherosclerosis, surgical procedures might be required. Angioplasty involves inflating a small balloon in the narrowed artery, to widen it. A stent, a small mesh tube, may be placed to keep the artery open. In a bypass graft, a vein from another part of the body is used to reroute blood around the blocked artery. These treatments aim to address the contributory factors of atherosclerosis and provide symptomatic relief. However, it's important to remember that these measures manage the condition rather than cure it. Remember, prevention is always better than cure. A healthy lifestyle can go a long way in keeping atherosclerosis at bay. So, eat wisely, exercise regularly, and listen to your body's signals. Atherosclerosis might be a progressive disease, but with the right approach, it doesn't have to dictate your life. Homeopathy provides a holistic approach to managing atherosclerosis. This system of medicine views the body as a connected whole and seeks to treat the individual, not just the illness. In the case of atherosclerosis, several homeopathic remedies have shown promise. First up is Calcarea carbonica, derived from calcium carbonate. This remedy is especially helpful for individuals struggling with high blood pressure and excess weight, two significant risk factors for atherosclerosis. It works by improving circulation and aiding in weight management. Next, we have Lycopodium clavatum. This remedy is particularly useful for dealing with hypertension and liver impairment associated with atherosclerosis. An added bonus is its beneficial effect on varicose veins, a common issue in people with this condition. Aurum metallicum, derived from gold, is another potent remedy. It strengthens heart muscles and vessels, combating the hardening and ossification associated with atherosclerosis. Last but not least is Cactus grandiflorus. Sourced from the night-blooming cereus, this remedy is used to alleviate chest constriction and breathing issues often seen in angina, a condition caused by reduced blood flow to the heart. Remember, homeopathy is not a replacement for conventional medical treatment, but can be a complementary approach. Always consult with a healthcare professional before starting any new treatment regimen. Homeopathy offers a different perspective on treatment, focusing on the whole person rather than just the disease. In this video, we delved deep into the world of atherosclerosis. We explored its pathology, starting from arterial injury to the formation of life-threatening clots. We highlighted key risk factors like smoking, obesity, and an unhealthy diet. We also discussed prevention strategies, focusing on lifestyle modifications and control of medical conditions. We covered mainstream treatments, including medication and surgical interventions. Lastly, we touched upon homeopathic remedies offering a holistic approach. With this knowledge, you are now better equipped to understand and manage atherosclerosis. Stay healthy, stay informed.